Hi there everyone, this is Dr. David Morris with Magnolia Medical Center, and today I want to talk to you about knee pain and knee replacement surgery. Before I do that, I want to start off with a story. I recently had a patient, a 63-year-old male patient, whose wife made him come to the clinic, go figure, to get a second opinion about knee pain. This patient looked at me and he said, "Doc, I've been told I've got bone-on-bone arthritis and that there's nothing can be done except for knee replacement surgery. That's the only option." Now, I personally thought this was quite interesting, that this patient had it in his mind and was told that knee replacement surgery was the only option for someone with this situation. Folks, the fact of it is that nothing can be further from the truth, and I want to show you a little bit about the things that can be done to help a patient avoid knee surgery, even if they have bone-on-bone arthritis. Now, the wife had some very legitimate concerns, and she wanted me to help her convince her husband about these concerns. She wanted to be aware that, number one, knee replacement surgery has no guarantees. Just because you have knee replacement surgery does not mean that your pain will go away. Many times it does. Number two, there's a big risk of infection. This is not a very simple surgery. There's a lot of cutting and a lot of things added to your body. And the third thing is that knee replacement surgery, this was her biggest concern, does wear out. The knee only lasts, the replacement knee, 10, maybe 12 years if you're lucky. Now, she was expecting him to live a long life, as was she, and they thought they would live into their 90s. And if he had a knee replacement at 63, the likelihood is that he would need additional surgeries throughout the rest of his life, and she didn't want to put up with that. The rehab from surgery is not easy. She knew she was going to have to take care of him. The rehab's tedious, difficult, painful, and she didn't want to put up with his whining. I can't blame her, I suppose. She said she wanted to know what we could do. So I want to talk to you, let's spend some time talking about the knee and what we do specifically here. First off, when you're looking at the knee, you have to look at the bigger picture. Instead of narrowing in on only the knee, you have to look at the entire process of what the knee does and how other areas of the body affect it. For example, the feet. If you have feet issues, a flat arch or overpronating or other feet issues, not necessarily foot pain, then every time you take a step, if the foot does not strike the ground properly, the knee is going to absorb a lot of those extra pressures. So you may have to address the feet with a good pair of custom orthotics, a good pair of custom inserts, even if you don't have foot pain. Next, you have to look at the hips. Every time you take a step up the stairs or down, if you're walking around your home, even on the sidewalk, your hip has to swing forward, then plant the foot, then the other hip has to swing forward and plant the other foot. A lot of mechanisms involved there, and if you're over-tracking or under-tracking, or if the hips are rotated and out of place, you're going to have problems and your knee is going to absorb those pressures as well. Well, what if you have feet and hip problems? Your knees are going to absorb twice as much due to those issues. It's like a car that is the front end is not lined up. If that's the case, then those tires are going to wear out prematurely. Folks, my dad was a body man. He told me if the car's not lined up, you can plan on replacing your tires. So if that happens in your body, then knees are going to wear out prematurely as well. Next, you've got to look at the lumbar spine. You've got 5 lumbar vertebrae, and from each comes nerves to your leg, your knee, your lower leg, and your foot. Now, in the lower lumbar spine, these nerves go to the feet, into the legs, the knees, the thighs, and to the hip. That doesn't mean that if you have low back pain that you're going to have knee pain. But if there is damage or impingement of the nerves that come from the low back and go to your leg, anywhere in your leg, and affect the muscles, ligaments, tendons, bones that resolve the knees, then no knee replacement surgery is going to address any of those things. If you've got lumbar spine problems impinging a nerve that causes pain in the knee, again, no knee replacement surgery is ever going to fix that. If you've got hip or feet problems, no knee replacement surgery is ever going to fix that either. Folks, even as something as far off as orthopedics as Chinese medicine is, where they talk about the adrenal glands and the effect of the adrenal glands on the knee issues, problems like fatigue, cortisol, extra stress, those can even exhibit as knee pain. Next, you have to look at inflammation. So starting with the knee and treating it with anti-inflammatory creams, not steroids, but you might also have to look at inflammation throughout the whole body, and systemic inflammation. Folks, you can't build a house when it's on fire. Inflammation is not helpful in improving how your body functions. Then you have to address the knee joint itself. For example, The popliteus muscle is a muscle that sits behind the knee, and it's important when looking at knee function. Many people call the popliteus muscle the key to the knee. This is a small muscle that sits behind the knee and is responsible for doing a very small motion. But if it is not working, then you're going to manifest knee pain, especially over time. And very few people come to our office and have ever heard from an orthopedic, hey, we need to address the function of that popliteus muscle. Finally, you've got to look at the quad and the hamstring muscles, the front and the back of your leg. Those connect to the knee and around the knee. And if those are imbalanced, one strong on one side, the other weak on the other side, the knee's not going to line up correctly. This can have a huge impact on the kneecap or the patella and how it tracks over the knee, causing arthritis behind the kneecap as well. If these muscles are out of alignment and out of balance, then this can also manifest as knee pain. Not any of the things I've said can be fixed with a knee replacement surgery. You could probably tell I'm not a big fan of having your knee replaced. If you have any of these problems, you're going to have knee pain. And guess what? Knee replacement surgery is not going to fix those things. Folks, if we can help you, give us a call. Our phone number here at the office is 615-225-9100, or you can check out our website at www.midtnknees.com. We'd be happy to sit down with you, talk with you about some of the unique and innovative treatment options that we have and how we fix things and get the patient feeling better, again, without the need for knee surgery. Please check out our success stories on our YouTube channel or on our website. We have success stories of people who were told they have arthritis and surgery was the only option. Folks, if you found this information to be useful, please go ahead, hit the subscribe button on the button right below there. Just hit that button that says subscribe. Please do me a favor, share this video with your friends and family and other people that might be suffering. If you subscribe to our channel, you get updates on other information about your health. We come to work every day to improve the lives of the people in our community and to try and help others. If you would share this, it would mean a lot to us and our ability to help other people. Again, I'm Dr. David Morris. Please continue on the road to good health. Have a great day.